Welcome back to On the Pulse, everyone. Well, I want to introduce you to Dr. Bazzone. Now, he, of course, is over there at Doctor's Care and Vitamin Centre. I'm totally interested to find out, Dr. Bazzone, what it is that you're actually doing over at your medical centre. So let's start off with the programs that you do.
Well, Doctor's Care is involved with several programs. The first and foremost, which we started out with, was hormone replacement.
Oh, wow.
Yes, and then we gradually got into doing cosmesis for women and men.
Okay.
And we're now evolving into doing wellness care and also weight reduction.
And that's what everyone's talking about now as well. Let's start off with the hormones. Now, what are you doing in the treatment cases for those?
Well, in the practice of hormone replacement, it's a matter that men and women have lost their hormones as they get older. And the process of going through this is introducing them to what is happening to them, finding out exactly what is happening to them, and then doing the appropriate testing in order to find out where they stand hormonally. Mm-hmm. After we do that, then it's a matter of prescribing the correct amount and correct types of hormones which they need.
Okay, but how do you find out if you're low on hormones? What sort of testing do you do?
Well, first of all, the patient knows that they are low on hormones.
What are some of the signs?
Some of the signs are, let's say, for instance, women. Women go through menopause, men go through andropause, and they all have just about the same symptoms. Yeah. They lose their energy, they lose their get up and go, they start putting on weight, accumulating fat rather than lean muscle mass, they lose their libido, and life just becomes sort of miserable.
Okay. And that can happen for men and women.
Exactly.
And does it really matter of what age?
Well, usually women start noticing primarily when they hit menopause.
Really?
Which will be in the late 40s. But hormone loss really starts taking place at age 30.
Okay.
And at age 30, you're actually losing 1.5% of your hormone production per year.
Wow.
Which becomes significant as you get down the line.
Well, I want to talk a little bit about the next part of your practice is the wellness centre. What's involved in a wellness checkup?
That is sort of an all-inclusive evaluation.
It is, isn't it?
Right, because what we're looking for is what is going on with the patient.
Yeah.
And it's a matter of, so to speak, using a broad brush in order to get the appropriate picture painted. We put them through a variety of testing, determining where they are lacking with respect to hormones, with respect to electrolytes, liver function, kidney testing, mental function, etc. And once we get the answers to all these questions which we ask them and do the appropriate testing, then we put it all together into a composite and make a prescription for a regimen of treatment.
Okay, now with the weight loss assessment program that you have there as well, just touch on that briefly for me because we are going to come back to that.
All right. Weight loss is really not a puzzle. Weight loss is very simple, but it's a matter of getting the patient to understand it and to go along with the program.
Okay.
Weight loss, we counsel them on what puts on weight, and it's primarily the calories you put in.
It's what you put in that mouth, Dr. Bazzone. I know, you're telling me.
Well, not only is it a matter of the calories you put in your mouth, but it's also the bad food choices you make. Food is not all food. A lot of the foods we eat are filled with toxins, which do nothing but countermine our state of good health.
I got you. All right, how long have you been open over there?
We've been open on Common Lane Road for the last year and probably 8 months.
All right.
But I've been doing this for approximately 8 years.
Amazing. Well, we appreciate you. We're looking forward to more conversation. If you want to find out more information, there it all is up on the screen, phone number, address, and also website as well. We appreciate you watching On the Pulse. We'll be back after this short break.